Well, yeah, my God, I thought my husband was still living.
Now, where'd you think he was?
When they told me that he was gone,
Mm-hmm.
I couldn't believe it.
But you're okay, though, right?
Well, I don't know.
You're okay, Graham. Graham, you're okay. Listen up. Here, give me the hand. We do the hand holding. Listen up. Fritz, you know his name, right? Fritz? Yeah. He's been gone for 6 years and he died in his sleep.
In the story, The Jilting of Granny Witherall, the grandma shows signs of Alzheimer's. Alzheimer's is on the rise and eventually may be an epidemic. It's important for everyone to know more about the disease because it is most likely they will be faced with it some way or another. Alzheimer's is an irreversible degeneration of the brain that causes disruptions in normal everyday things that we do not think about, such as memory, cognition, personality, and other functions that eventually will lead to death from complete brain failure. Today, more than 5 million people in America alone live with the disease, and by 2050, it is estimated that nearly 15 million people will be diagnosed with Alzheimer's. In the world, nearly 44 million people are diagnosed, making it to where every 4 seconds a new case occurs. Alzheimer's is the 6th leading cause of death in the United States. Many people believe that Alzheimer's is a new disease, but however, it is said that ancient Greeks and Romans described symptoms resembling Alzheimer's. It is very difficult to diagnose someone with Alzheimer's because some of the symptoms are very similar to just old age. But today, there is technology that allows doctors to make a more accurate diagnosis. Doctors rely on memory testing, physical evaluations, and personal accounts from relatives living with a person with Alzheimer's. Some symptoms include forgetting what an item is used for, losing language skills, lost sense of time, they may not remember people that are close to them, and they get lost in familiar places. These few symptoms that people with the disease present can sometimes make it hard to live on their own or with other family members, for they need intensive care and supervision. One place people can obtain the care they need is a nursing home. Morgan is a CNA at a local nursing home, and here's what she has to say about working with people with Alzheimer's. What are some things that you have to do for residents with Alzheimer's that you don't do for any of the other residents?
We do a type of validation therapy, which is where we tell them what they want to hear, kind of. For example, if, say, a lady is saying that her husband's going to come visit her and he died like 5 years ago, then we will tell her that we'll keep an eye out for him or let her know. But because we don't want her to relive that over and over again that he did pass, so we just kind of let her think that because she's going to forget anyways.
Okay. Are the residents with Alzheimer's usually able to do some things on their own, or do they have to have 24/7 help?
It depends on what stage of the dementia that they're in. If they're in the earlier stages, they can do a lot of things for themselves with supervision. But when they're in the later stages, it becomes terminal to where they can't do really anything.
So they rely on you for everything?
Yeah.
Do the people with Alzheimer's have many family members that come visit them, or are they basically all alone?
It depends on the family and if they live close or if there's a lot of them. I've noticed that when they're in the later stages that their family will come more often because they can't do as much for themselves. They want to make sure that things are getting done.
Is it obvious that a resident has Alzheimer's?
It depends on the resident and how far their dementia has progressed.
What things do they do that show that they have Alzheimer's?
For example, some residents go through a thing called sundowning, which is where it'll get a lot worse in the evening and when the sun does go down.
What are some signs that they are entering the first stages of Alzheimer's?
Well, it's a little harder to notice unless you know the people. They don't notice their family members as easily, and they just say some off-the-wall things.
Okay. Are there a majority of Alzheimer's patients male or female?
Well, in my facility, they're mostly female.
Okay. Thank you.
Thank you, Morgan.
The early stages of Alzheimer's disease can and may be managed at home. If a family member with this disease lives alone, relatives may welcome them into their home to help take care of them. Regular exercise, good nutrition, social interaction, and activities are all important for Alzheimer's patients to practice. And the family may also help reinforce that schedule as well, just to keep them on track. Treatment for Alzheimer's cases are based on several major factors, and these factors include age, overall health of patient, medical history, tolerance for specific medicines, and the patient and caregiver's opinions and preferences on the different types of treatments. Medications that may be prescribed to an Alzheimer's patient all depend on the stage that the disease is at, such as mild, moderate, or severe, and it also depends on what drugs the patient is able to take. Medications such as Aricept, Exelon, and Razidine may slow the progression of the symptoms, but for only about half the patients that are taking them, and for a limited amount of time, for an average about 6 to 12 months. Some side effects of these drugs are confusion, dizziness, constipation, tiredness, and headaches. Studies are looking into seeing if vitamin E is aiding in the slowing down process of the mental decline Alzheimer's comes with. Clinical trials are being looked at to see if they can slow down the progression of the disease or improve memory loss. There are also many studies being done to see if Alzheimer's can be detected earlier before the horrible symptoms start to surface. This picture shows a deterioration of the hippocampus, which is where all your memory is stored in your brain, and you can clearly see that the memory and language portion of this brain are being eaten away by Alzheimer's disease. This patient most likely has trouble with verbal skills and probably even remembering things that you and I just recall normally on a daily basis.
With more than 5 million people diagnosed with Alzheimer's today, it is obvious that this disease is not picky about who will obtain it. With it being estimated that the disease will continue growing, it is good for research to grow as well in order for us to put this disease to a halt or at least to slow it some way or somehow. Everyone will be faced with the disease in some way or another, whether it's a loved one diagnosed with it or them themselves, so to be well informed on the topic is a good thing.